Before we begin, I'd like to share a quick visual to be used as an analogy. So one day, the farmer is tending to his garden. Assume that all variables are normal and that there's enough sunlight, enough water, the nutrients. The crops are thriving and they're growing and everything is good. What the farmer fails to realize is that a weed appears on the garden. And so a couple hours later, the weed grows to 3, then to more, until it is too late before he realizes that the entire garden is engulfed in the weeds. And how he realizes this is by the fact that all the crops have died. You know, they're all withered away since that the weeds have taken up the space and the nutrients that they can no longer thrive. And so in a similar way, cancer is like a weed in the human body. A simplistic definition of cancer would be the uncontrollable growth of body cells or somatic cells. And these cells follow the cell cycle for growing and dividing during cell division. And so each phase provides a different set of conditions. And at the end of each phase, there's a checkpoint to make sure that each of those conditions are met. In cancer cells, however, there are no checkpoints, and so the cell can aimlessly walk through each phase and grow and divide at a very rapid rate, uncontrollably. And this is caused by a mutation. And so all cancers start in normal cells. The mutation occurs to cause an abnormal cell that then multiplies uncontrollably to a large tumor. And so then the large tumor and cancerous cells take up space and nutrients from healthy cells and latch onto vital organs like the heart, the liver, and the lungs. But what really makes cancer so deadly? You know, some may say, oh, I have a huge lump of cells that just like grow unnaturally, but my body's working, right? Well, for now. Once there isn't enough space or nutrients in the cancer's original spot, what's going to happen is that cancer is going to migrate to a different area of the body. And this process is called metastasis. And what's going to happen is the original tumor is going to stay in the same location, but certain aspects of it is going to travel through the blood vessels to a different area of the body. And this is going to keep happening until it's spread throughout the entire body, like the weeds were sprouted all throughout the garden. And cancer is a bit of an umbrella term for multiple different types of diseases, since there are very, very many different types of cancer. Let's dive into one in particular. We'll go with lymphoma. Lymphoma takes place in lymph nodes. If you can see in the top right, that is the lymphatic system of the human body. So you can see the lymph nodes are all throughout the body and also close to very vital organs. They function as sort of a filter for unwanted materials, particles, and infections, mostly, in the body. So there's a lot of immune system cells and infection-fighting cells, one of which being lymphocytes. And this is where the cancer originates in. There's a mutation within a lymphocyte cell, and it begins to multiply, and the lymphoma has started. So there are 2 types of lymphoma. There is Hodgkin's, which contains the presence of Reed-Sternberg cells, which are large lymphocytes with multiple nuclei in the cell, so multiple nucleus, more than one nucleus in the cell. They form in the upper body area of the lymph nodes, so in the armpits and the neck, and usually in younger individuals that are diagnosed with lymphoma, having a median age of 39 years old. Non-Hodgkin's lymphoma is the other form of lymphoma that does not contain Reed-Sternberg cells, can form in anywhere in the body, so any of the lymph nodes along with the spleen and the bone marrow, and normally is found in older individuals having a median age of 55. Luckily, lymphoma is very, very treatable. 72% of non-Hodgkin's lymphoma patients have a 5-year relative survival rate. So for those individuals, some of them may live under that 5-year relative survival rate, or they may exceed it by 10 or even 20 years as well, becoming cancer-free after being diagnosed with it. And for Hodgkin's lymphoma, 87% meet that 5-year mark. So compared to other aggressive cancers, lymphoma is very treatable and very survivable. In the other graphic, we can see the warning signs of lymphoma, some of which being excessive sweating, lumps found in the neck or armpit signifying tumors forming, the swelling of the face and neck as well, breathlessness, itchiness, loss of appetite and weight loss, and many more. But the severity of the cancer not only depends on the type of cancer, but also the stage of it. So there are 4 stages of cancer. And for this exercise, we're going to focus more on kidney cancer, as that's what the images graphics show. So there's not much difference between stage 1 and stage 2 cancer. They're relatively the same, since that they both sort of form on the outskirt or on the surface of organs. They're very superficial and they're relatively small compared to stages 3 and 4. Obviously, as each stage gets larger, the size of the cancer increases. So stage 2 cancers are larger in size than stage 1. However, a good and optimal mode of treatment is surgery for both of them, since that they're superficial on the organ, they're very easy to access. In stage 3, not only has the cancer grown in size, it has also seeped into the organ. So what you can see in the infographic is that the cancer has now seeped into the blood vessels, the tissue, and the fat of the organ itself. So at this point, surgery isn't as much of an option at this point. If surgery was the mode of treatment, the entire kidney would probably have to be removed. And finally, stage 4 is the most severe stage, as now the original cancer has spread from the original site and to a different area. So metastasis has occurred, and the cancer has now spread throughout the body to potentially the lungs, the liver, the bones, or the brain. And so as the stages increase, the survival rate decreases. But there are multiple different types of treatments, and the physicians can choose any different combination of them, and that depends on the conditions of the cancer. And so probably the 2 most common and 2 most well-known types of treatment would be chemotherapy and radiation. And if we go back to our analogy of the weeds, chemotherapy and radiation would act as a plant killer solution. If we think about a plant killer solution, if you spray that in a garden, yes, it's going to take out the majority of the weeds, but it's also going to affect the crops in there. And that's exactly what chemotherapy and radiation does. It will target the cancer and remove the majority of it, but it will also kill off healthy cells surrounding that area. So what patients experience with these treatments is they will experience severe phases of sicknesses, since the healthy cells are also getting killed inside of their body. So they're more susceptible to illnesses. As I described earlier, another form of treatment would be surgery. And this is most optimal when the cancer is small in size, or if it was caught early enough. And so this would be similar to just pulling the weed out as soon as the farmer first noticed it, or if he had noticed it when they first originated. Another type of treatment would be target therapy, which would be very similar to weed killer solution, since that it'll only kill the weeds, or it will only kill the cancer cells. The only downside to target therapy is it's very, very selective. So one target solution would not be able to kill two different types of cancers. It's only specialized towards one kind, which is the downside of it, since there has to be multiple different types of target therapy. Finally, another option that could be used would be immunotherapy, which is a rather new treatment option in this field. And this is used by injecting the immune system of the patient with genes that allow for the immune cells to detect cancer cells. And so it's allowing the body to fight the cancer. And this is very similar to weed-eating insects being introduced to the garden to eat and break down the weeds in a more natural way. But regardless of the treatment plan, the patient is going to endure a rigorous and difficult journey battling the cancer, because ultimately it boils down to the fact that life will out. And what I mean by that is life will always find a way to continue on. And given that cancer is technically alive, it's trying to survive in this hostile environment that is the human body. Because to the cancer, we are the threat. We want them out. We want them exterminated. So the cancer is going to do everything in its power to stay alive. So it's not going to give up, and it's going to put up a good fight, which makes treatment so difficult. But that does not necessarily mean that being diagnosed with cancer is the end of the line for you. Though there necessarily isn't a cure for cancer, these treatment options, as well as the ones to come, provides the best chance for patients for a long and lasting cancer-free life. And doctors can minimize the spread and lower the chances of cancer returning to the body once it's removed. This could not have been done for the cancer organizations in the entire world. These are some of the millions of cancer organizations and foundations established that have raised money and awareness for not only research or for cures, new treatment methods, anything. It also raises money for families who are affected by cancer. And so without them, science would not have been able to advance as far as it has in knowing as much as we know about cancer. But with them, we can also achieve the unimaginable. Thank you.